So we'll go ahead and get started in hopes that our final panelist will join us. As he is a member of student government, he will be with us shortly. So let us officially begin our panel discussion entitled COVID-19 Vaccine and Communities of Color. My name is Dr. Jermaine Wright, and I serve as the Vice President for Student Affairs at Lehman College. Before I go ahead and introduce our panelists, I want to begin to set the context a bit for our conversation. So based on data from New York City Department of Health, it is shown that Black and Latinx New Yorkers are twice as likely as white New Yorkers to die from COVID-19 virus. The analysis by the Community Service Project found that COVID-19 infection rates were highest in the Bronx, with 32% of low-income Bronx residents said that they or their family members had been infected by COVID-19, in comparison to just 19% of those living in Manhattan. Therefore, the purpose of this panel will be to discuss COVID-19, its impact on communities of color, and the vaccination process. The panelists are comprised of scholars, academics, practitioners, and all around great people who I've gotten a chance to meet with prior to our conversation here tonight, and I would like to introduce them. I'll begin with Dr. Sheldon Fields. And before I begin, I just want to let folks know that this is indeed being recorded by our Student Government Association to ensure that even though we may not be mindful in numbers yet, this message will resonate with numerous amount of students thereafter. In addition, I would also like to acknowledge the sponsors. So the Student Government Association, under the leadership of Jada Quinlan, is one of our staunch advocates around student supports. And when I went to her and said we wanted to have this panel, she said, of course, student government will support. In addition, our Office of Campus Life, we have a representative or several. I did see Suzette Ramsunder, as well as David from the Office of Campus Life on the call, also joined us in order to bring this panel discussion together. And then lastly, the Urban Male Leadership Program in Playa Futura, which is led by Michael Dees, who is a good friend, as I've been working with Michael for approximately, it seems like, about 15 years now, since my time with CUNY BMI and now here at so now that I've kind of acknowledged everyone, our sponsors, I do want to give Dr. Sheldon Fields some time to introduce himself.
Good evening, everyone. I'm Dr. Sheldon Fields. I'm currently the Associate Dean for Equity and Inclusion in the College of Nursing at Penn State University. I also have the pleasure of serving as the first Vice President for the National Black Nurses Association. I am a nurse of 30 years. I am an educator, a researcher, and a nurse entrepreneur, and I have a research specialty in HIV/AIDS. I'm absolutely delighted to be here with you this evening.
Thank you so much, Dr. Fields. Next, we have Dr. Julius Johnson III. If you'll please introduce yourself.
Good evening, everybody. My name is Dr. Julius Johnson. I am currently an associate professor and the chair for the School of Nursing at Long Island University, Brooklyn, where I also serve as the director of the Family Nurse Practitioner Program. I have the pleasure of being the president of the Greater New York City chapter of the National Black Nursing Association. I serve on the nominating committee for the national organization, and I also specialize in home-based primary care.
Thank you, Dr. Johnson. Next, we have Dr. Michele Crespo-Fierro. Could you please introduce yourself?
Good afternoon, good evening, everyone. I am Dr. Michele Crespo-Fierro. I am a clinical assistant professor at New York University, Meyers College of Nursing. I also serve as a director of the Lead Honors Program for the undergraduate traditional students. I serve as president of the New York City chapter of the National Association of Hispanic Nurses. I also serve on the board of the Greater New York City Association of Nurses in AIDS Care. And that's where my specialty is. My clinical specialty is in HIV care. My research specialty is in cultural care practices and linguistically appropriate services. And I am a born and bred New Yorker from Manhattan, Upper Manhattan, Inwood, and Washington Heights, with tons of connections to the Bronx.
Thank you so much. And we have also our very own Dr. Sandra Maldonado.
Thank you, Dr. Wright, and welcome everyone here. Thank you so much for inviting me. I am assistant professor at the graduate program of nursing for OBGYN and primary care. I'm a family nurse practitioner, board certified. I'm a certified nurse midwife and a sexual assault nurse examiner. My specialty is OBGYN and caring for both Hispanic and Black women, which there are a tremendous amount of disparities there. I also serve the community of the South Bronx at Boston Road Medical Center, where I do a lot of the OBGYN and also a lot of the treatment there for menopausal care. Thank you.
Thank you. Next, we have Bernard Kawapong T. Did I get it right, Bernard?
You got it totally wrong.
Oh.
Good evening.
Please help me to.
My name is Bernard Kwapon Tete.
Okay.
I'm a senior student of Lehman College. I was about to say Bronx Community, sorry. I'm part of the SGA. I serve as the student senator for the Student Legislative Council. Nice meeting you all.
Thank you so much, Bernard. And lastly, but not least, we have Gabriel Pabong.
Hello, nice to meet everybody. I'm Gabriel Pabon. I'm a junior student at Lehman College. And I'm also a member of the Urban Male Leadership Program as a mentor, and it's nice to meet you guys.
Wonderful, thank you. So now that we've gone through the introduction of our panelists, we want to jump right into it because we do want to get through these list of questions that I have for the panelists, but then also to get to your questions because Jada and SGA have come up with some wonderful questions to ask the panelists that hopefully we will be able to answer within the context of our panel, but I'm sure there's quite a few more that we will not be able to answer within the panel. So the Q&A section will serve just as that. So as I indicated, the questions are broken up into 3 areas. So for our first battery of questions, we'll discuss COVID-19. What do we know about the virus? So this first question goes to Dr. Fields and Dr. Crespo. How is COVID-19 transmitted?
Did you want to start, Dr. Fields, or?
Oh, go ahead. Go ahead.
Okay. So really important, how is COVID-19 transmitted? So we know that COVID-19, the virus that causes COVID-19, SARS-CoV-2, predominantly resides in respiratory secretions. So anytime that anyone is speaking, coughing, sneezing, singing, breathing heavily, the virus particles are going into the air. And if you are in close quarters with that individual, you're very close to them, maybe you're having a conversation, it's very easy for you to inhale those particles, and then the virus is able to take hold in your body. Some other things that we do know is that even if you've moved away from an area, it is possible that these particles can stay in the air, and then someone else who comes in that area can then inhale that. That's called airborne transmission. So those are predominantly the 2 ways. As far as getting anything off of what we call fomites or a table or a chair or a doorknob, that can happen, but it's not as likely to cause the transmission as we know with droplet and or airborne transmission. I don't know if you wanted to add anything to that, Dr. Fields.
So one of the things that I would add is that this virus is of a family of coronaviruses. It is not a new type of virus, but this is the virus that was found in Wuhan, China back in 2019. It's called coronavirus, 19 because of the year in which this particular strain of the virus was founded. So we've encountered these types of viruses before. And I don't think a lot of people know that. There's been a lot of controversy and talk and even some myths about how it came about. It is a zoological virus, which means that it is transferred from animal to human. So that's really how we got here with coronavirus. And we all know that you can prevent or decrease the transmission of it by social distancing, wearing masks, washing your hands, washing your hands, washing your hands. So you say it 3 times, you know, that's educational pedagogy. Say it 3 times, they'll hear you. So thank you for that beginning question, Dr. Wright.
Thank you so much. So that's a perfect segue to the next question, which will be for Dr. Johnson and Dr. Maldonado, which is how effective is social distancing, mask wearing, and washing your hands, washing your hands, washing your hands?
Well, we know as nurses, that's one of the things that we always practice is washing our hands. And that has to be the best way that we can prevent any type of transmission. Also, social distancing, just like Dr. Crespo and Dr. said, that's the importance of you keeping a distance so that the aerosol doesn't travel through as we speak to one another. If you look at some of the statistics that we found in cruise liners, where people are in crowded areas, and they're mixing with one another, there was a tremendous high rate there. And many of the people who were on these ships were quarantined. And then they started investigating about this whole social distancing of the 6 feet. Were you safe? Masks are important because, again, we're not transmitting that aerosol to one another. Not only am I protecting myself, but I'm also protecting Dr. Johnson if I were to speak with him and I had a mask on. It would be rude of us if we didn't have a mask and still think, oh, I can't transmit it, and not know what our status is, because today you could be negative and tomorrow you could be positive. So you never know when you're transmitting this aerosol to and back and forth. Dr. Johnson?
Yes, and you did a great job explaining, Dr. Maldonado. The only thing I would ask is, if it needs to be put in layman terms, think of the concept of when you was growing up and you was sneezing or you was coughing, your parents told you cover your mouth. They told you cover your mouth so it doesn't go anywhere else. Think of the mask as a permanent way to cover your mouth, right? You cover your mouth, you cover your nose. The other thing is, if you need an example of how effective social distance is, think about how rampant the virus spread amongst our communities and our neighborhoods, because we tend to have to live with more people in order to afford rent. Right? We tend to work in more crowded areas, and we tend to have to use the public transportation systems to get around. There was no social distance in any of those, which plays a huge role in us becoming more effective with the virus.
Thank you for that. And that's a prelude to what we're going to discuss next in our battery of questions. But before we go there, I wanted to turn to our 2 students on the panel and ask them, how has COVID-19 impacted you as a student?
So I'll use myself an example because Lehman College, let's bring it back to Lehman College. Lehman College is more of diverse school, because we have people coming from all walks of life, especially CUNY. You see that we're more diverse because we see people coming from different walks of life, immigrants and first-generation students, and people have to combine going to school and working at the same time because we have to feed our family, feed ourselves, and still hope for a better future. So having this in the system, we have to change our whole pattern of life as we used to be. Me starting school here, I used to go to classroom, I used to meet my professor. I like something visually. Most of our students want their hands on with the professor, but all of a sudden we have to come back home. We have to be in front of the computer to be able to learn something. We have older generation, people in their 40s and their 50s wanting to go back to school. And those people at that time going to school wasn't like this. So it's really been a hectic way of learning, but it also has a very positive side to me per se, because I get to learn on my own pace. Since we had the synchronous and the asynchronous, that I'll give it a high five. I like it because I could choose an asynchronous class and learn on my own pace rather than going to school. So COVID has had a negative and a positive impact on students as a whole and on us as an individual. Everyone will say that COVID has a negative impact on us. That's true. We all know that COVID has affected us in one way or the other. But it's also giving us something positively to think about. I gave my example as having to learn on my own pace. I don't know what Gabriel has, but having the ability to learn on my own pace for me is a very nice way to balance myself as a full-time worker, taking care of a little one and still going to school. So even if I get off at work and I still want to learn, I could do something by myself, knowing that my little brother is home and he's not going to school. So I would say it has affected us, but it has affected us both sides. But the negatively is more condensed or more in depth than the positive side. That's what I would say.
Thank you, Gabriel.
Really insightful and nice to hear, Bernard. Actually, COVID has affected me in quite a few ways. Of course, the most traumatic would probably have to be in the deaths of some people that I have known personally. There were a lot of people at first during the beginning of the pandemic that were very doubtful, and they weren't as careful as I would warn them to be. So sadly, it either resulted in death or them having to go to the hospital because they're not able to breathe on their own, or some other complications came. There is also an aspect of school. Luckily, I was able to kind of, in previous semesters, mix up some of my classes. So I was kind of used to the online aspect. So that wasn't too bad. And just to add on to what Dr. Johnson was talking about in terms of like communities of color, we tend to be very family-based and community-based. So I was able to see like a lot of my family members get sick. Luckily, there wasn't many complications with their, when they were sick. But people in my community, a lot of Spanish people, a lot of African Americans, a lot of minorities especially, we like to, be with one another. And just seeing kind of like the community break down as more deaths came in, and we heard about, oh, this guy died, and kind of like we're just losing. Well, thank you, Michele. We're just losing like parts of the community, and it was sad to see that. I've had a lot of friends that have faced depression. There was a moment that I kind of was a little down, and actually in seeing a lot of reports, there was a lot of young people, especially with the job losses and the loss of family members and people getting sick and having to stay inside. We actually saw happiness levels in the world of young people, especially, they dropped down. And just to end it off, I also was sadly let go of my job. Luckily, I have the Urban Mayor leadership to help support me through that, as well as the unemployment checks that came in to help out. So now I'm better able to support myself and my family and give whenever I can, because I know there's a lot of people that are worse off than me.
Thank you. Thank you. Again, the next battery of questions will focus on the disproportionate impact COVID-19 has had. I'm not sure if any of you have seen the more recent 60-minute documentary that aired last Sunday that spoke to the correlation between racism, between communities of color, and health disparities. It was a 13-minute piece that was done on 60 Minutes, and it was really an eye-opening piece to really resonate or bring home the point that structural and institutional racism still plagues our society in ways in which that have lasting impacts, not only on our health, mentally and physically, but also on health disparities, job attainment, high incarceration rates, higher education attainment. If we think of the Bronx as being the 62nd county in New York State, which is often at the bottom rung of all of these achievement levels that I've just indicated. So my next question will go to Dr. Johnson and Dr. Maldonado. And I think he alluded to it before, Dr. Johnson, and Gabriel touched on it as well. But the question is, what role does race play in the COVID-19 mortality rate? And are there other factors?
Dr. Johnson, I'm going to let you go first, and then I'll go, if that's okay with you.
Yes, absolutely. So race plays a huge role in COVID-19, just because the system that we operate in and of itself is racist. And people have to understand that. Like when we're talking about racism and we're talking about the structures that surround things. So let's break down the healthcare system, for example. And let's compare the healthcare systems in the Bronx, because that's where Lehman College is, and Brooklyn, because I'm a Brooklyn boy and I'm biased. And let's compare them to Manhattan, right? Now, for those of you in the Bronx, y'all are a little closer to some of the hospitals in Manhattan, like Columbia Presbyterian. I can almost guarantee that the majority of you, though, have never been to Columbia Presbyterian. Even more you probably have never been to Weill Cornell Presbyterian, right? These hospitals have dramatically better outcomes than some of the hospitals that's in the Bronx, like Lincoln Hospital, right? Like Jacobi Hospital. And they get the best treatments, right? But then also you think about certain hospitals like Memorial Sloan Kettering. That's the #1 cancer center in the world that's located in Manhattan. They tend to not take a lot of the insurances that lower income Black and brown people have. I experienced this firsthand when I graduated from my doctorate and came home to find out that my aunt had cancer and I wanted her to go to Sloan and we was told no, buy Health First, right? So you think about us not having the access to the best care, right? And then you go to some of our hospitals, some of our city hospitals, because it's so overcrowded, when you walk into that hospital, it almost feels like the hospital of a war zone, right? And just meaning the amount of people that they have crowded in one area. And I could use a specific example of Brookdale Hospital in Brooklyn, New York. My aunt used to always go there every time after she had a seizure. When she had cancer, I took her and I put her in Manhattan hospitals. She had no idea that these same type of hospitals existed right here within New York City. So you think about the way that care is broken down. You think about our access to that care, whether it's through being able to afford it, through the insurance that we are given and commissioned. And then you also think about testing and treatments for it. So when COVID first hit New York and there had to be testing centers, they were all located in Manhattan, right? If we don't go to Manhattan for care, we're not going to Manhattan to get tested, right? So we had to get on the horn and talk to our politicians about the important need. And when I say we, meaning Dr. Maldonado, Dr. Crespo, Dr. Fields, we pulled together with the Black and Latin nurses to get our politicians on the phone and tell them, you're calling us heroes, but you're leaving our people to die because there's no testing centers where we're at, right? When you talk about the antibody treatments that people were getting, like President Trump, he had to be hospitalized and was on oxygen and then look better in a couple of days because he had access to all of the best treatments. And this was way back in 2019, right? We weren't having those same access at our hospitals. And that plays a role because those hospitals are located in Black and brown communities. But I'll switch over to Dr. Maldonado.
Dr. Johnson, very well said. And I have to say that working in the South Bronx has been very difficult when I have to sit down and explain to my women patients and also to parents if they're positive and what's the idea about getting the COVID vaccine. Many of them are terrified. They don't have trust in providers. And I am fortunate that I am one of them and I speak their language and I understand their culture. So I'm able to explain the importance of getting the vaccine. But also when I remember going into Bronx Care and seeing the trucks outside of the amount of people that had died from COVID, this was the majority of Hispanic and brown people who did not have the access to get tested in time or to receive the medical care that they needed. This broke my heart. Because why is it that other, and I don't want to sound racist, why is it that other populations are getting this care and we in the South Bronx, we're not getting it? And of course, I also wrote a letter to Ocasio and I said, what is going on? What is happening to us in the Bronx? Why aren't we getting this care for our people, the Black, the brown and yellow? Why aren't we getting this care? And I believe that perhaps she had pushed a movement so that we could all get the same care that they were getting in Manhattan, like Dr. Johnson said. another thing is when you're giving the vaccine, who is that provider? Does that person trust that Caucasian that's giving them the vaccine? Remember, if we go back to studies that were done, there is a mistrust because, you know, perhaps they're giving them something that is not for them. Should I trust this provider? So one of the things that we have to build in our community is trust, and that we want to help them as much as we can, and we want them to survive.
Thank you. Thank you. That's, again, you all, it's as if you're reading my mind, because it segues into our next battery of questions that we're going to touch on. But before we jump into just the reluctance of communities of color to get vaccinated, which is one of the questions, I do want to speak to the science a bit of the vaccine. So this question will be for Dr. Fields and Dr. Crespo is, could you please speak to the science used to develop the vaccines, in particular Pfizer, Moderna, and Johnson & Johnson?
You want to go first?
Why don't you start?
Okay, I'll start. So both me and Dr. Crespo-Fierro both have a specialty in HIV. We've been in HIV forever. It's how we met. And I know I get the question a lot. Dr. Fields, how is it that, you know, we were able to develop a vaccine for COVID-19 so quickly when we've been looking for a vaccine for HIV for 40 years? And it's a valid question. And I say this, because we have been looking for a vaccine, and because we have successfully developed other vaccines in the past, and you know, we give out vaccines for lots of other things, there already existed a scientific base and methodologies about how to produce vaccines. The technology was already existing and available. So when COVID-19 hit in a pandemic, which means it's literally around the world, there was a worldwide effort in a government-private partnership with pharmaceutical companies around the world to fast track a COVID-19 vaccine. Now, clinical trials take step 1, 2, 3, 4. We are still in a clinical trial with the vaccines we currently have for all of the companies, Pfizer, J&J, Moderna, and AstraZeneca, because all of them are being used under an emergency authorization use. And we are still collecting data on the implementation, the side effects, and everything. But I want to assure you all that in the development of these COVID-19 vaccines, that we did not skip any step in our clinical process. We did not. What we did was we condensed steps, we combined steps, we supercharged them, if you will, and we put our money where our mouth is in terms of the millions of dollars that went in to the production in a worldwide sharing of information that happened amongst scientists who were working on these various vaccines. The current 3 that are, well, 2, because one's on pause, the current 2
It's unpaused.
that are-
It's unpaused as of today, the CDC panel, yeah.
Yes, but they're going to, there's a lot of discussion. The CDC is meeting. There was a meeting at 6 o'clock when we started this.
Yes.
But I want to make it very clear that there is the messenger RNA or sort of the artificial vaccines that were developed, not a live virus. And then there is the vector-based, which means that there is a methodology that literally carries the agent into the cell. And it's all about stimulating an immune process in your body so that the next time you encounter the coronavirus, you are able to mount an immune response and suppress it. That is how vaccines work. So I'll stop there and I'll let
Mhm.
Dr. Crespo-Fierro add.
So I'll give a little more background on how our immune systems respond to whether it be a virus or a bacteria. So when our body recognizes it, it mounts an immune response and essentially controls the amount of that antigen to a level that you can actually control that. Your body can naturally do that. And antibiotics and antivirals can help with that. But our bodies then recognize a part of that antigen, and it's usually something on the outside of it. And in this case, it's usually something that allows that antigen to attach to the cells that it infects. So when our body then sees it, one thing it does is it's going to get rid of it, but it's also going to save a part of it so it can recognize it again. So that the next time you have an exposure, your immune system is going to kick in right away and control it and remove it. So when we get vaccinated, this is a way to get that your body to recognize this, even if you have never been exposed to it. And we've all been vaccinated. We've been vaccinated with against many types of diseases that in the past literally killed and maimed, many people. Many children did not make it to adulthood because of these childhood illnesses that we don't see anymore because we have these vaccines. So we are now using we use these vaccines in particular. Let's say we have our flu vaccines that we do every year because we know that there are some viruses that change a little faster. The bacteria pretty much stay the same. They don't change that much. But viruses tend to change a little bit more and more quickly. HIV is very elusive. That's a topic for another webinar. But here with COVID, we are planning. So we've got the vaccines in the two ways that Dr. Fields referred to. One is the mRNA and the other is the vector vaccine. And essentially what they're both doing in slightly different ways is bringing in just a little piece of that virus that would not make us sick, but is enough to trigger our immune systems to make those antibodies to fight against those viruses if we get exposed to them. So, and we know that there are really good results in preventing severe illness. So you may still get exposed, you may still get COVID, but you're not going to get so sick that you wind up in the hospital, that you wind up, being unable to be treated and dying. We know that that's how this works. And what is likely going to happen, because we have these new variants coming along, we're going to need a booster. And there are plenty of vaccines that we do boosters for all the time. One that we still get every 10 years, you get your Tdap, right? Your tetanus shot every 10 years, you've got to get that. So this year, likely we're gonna, what it's looking like they're saying is we're probably gonna need a booster sometime within the next year if you've been vaccinated. But these vaccines for the most part are incredibly safe. And we have years and years and years of work with vaccines in general. But with vector vaccines, we've got a lot of experience with, and also with mRNA vaccines. Even though it's the first time we're using it this way, we've been working with mRNA for quite some time. So I think that's enough. That's a lot.
No, I want to go ahead and share this very quickly because a visual is worth 1,000 words. So this is what I was talking about in terms of the process. The phase 1, 2, 3, 4, and 5, and 1, 2, 3, 4. And so we were able to shorten it. This is what Project Warp Speed did when we put the money in to developing it. So we did not cut any steps in the process. The other part is people ask about whether Black people or other minorities were involved in the clinical trials. And yes, they were. For Pfizer, Moderna, and Johnson & Johnson, you can see the percentages here for yourself. So they did include people from minority populations. So it wasn't people, we know it works for you. I want to go back to one other thing right here about the efficacy and this part right here. This is what Dr. Crespo-Fierro was talking about. They're safe. They lessen hospitalization. They decrease the death. Pfizer and Moderna have the mRNA vaccine type. AstraZeneca and Johnson & Johnson use the adenovirus vector type. So I'll stop there because it can get very complicated, but I did want to just show you a very quick visual.
Thank you for that. And if it's okay with Dr. Fields, as he's provided that presentation to me, that I share it, can I share it with folks as well?
Yes.
Thank you, thank you. I did want to go off on a bit of a tangent in this non-scripted piece, because it's always great when you have great minds here. So both Dr. Fields and Dr. Crespo-Fierro have done work with HIV. And I do want to bring the corollary around the societal stigma around contacting or contracting HIV and the expedient way in which COVID-19 vaccination came about in comparison to HIV vaccination, and look at some of the societal context behind it. In addition, I do want to speak to a bit around what we didn't learn as a society from the influenza in 1918 as well. And so I do want you all to speak to that, and I'm just singling you two out because of that, but I also open it up to Dr. Johnson and Dr. Maldonado as well.
So I'll start again, because I've spoken about this a lot. A lot of us, again, been working in HIV forever. When COVID hit, we had a deja vu moment. And it wasn't a good one, because at the very beginning, there was the fear, the unchecked known about the contagion, the fact that nurses had to be on the front lines with all this unknown, the stigma, the death, the no treatment. It all was like, oh, here we go again. And it was like right back to 1980, 81, and understandable. And then we were also extremely concerned for our population of HIV positive patients, those who are living with the virus, because we didn't know if they were going to be at an increased risk because of the problems with their compromised immune systems. But the good thing was we quickly saw that our patients, especially those on antiretroviral medications with their viral loads controlled, they were not getting sick. And one of the medications that was originally thought that might treat COVID-19, which was the remdesivir, is an HIV antiretroviral medication. So fortunately, we didn't see the outpatients getting sicker, and the vaccines at this point are also safe for HIV patients. The other crossover was the increased presence of HIV in Black, Latino, and other communities of color was the same thing we saw in COVID-19. So there was just too many similarities that scared a lot of us. So Michele, would you like to add?
I'd actually like to add that, you know, one of the huge issues with HIV was that it was very easy for people to say, oh, that's their problem. They check off a box, whether, you know, whether it's that they have men who have sex with men, whether it's sex workers, whether it's people of color, whether it's people who inject drugs or use other types of drugs. It was easy for people to say, oh, that's not me. I don't have to worry. But HIV and COVID, the same thing, it can potentially infect anyone. And what is now starting to be seen is that because we are sounding the alarm, and rightly so, that our communities are experiencing a greater impact. We have a greater likelihood of exposure, illness, and death. That's a fact. But what's starting to happen now is that there are communities in other parts of the country that are saying that's their problem. So they can get vaccinated. We don't need to get vaccinated. And we're now running the risk of not achieving that herd immunity, which means that, and this varies for whatever the condition is, that we need to have a certain percentage of people who have been vaccinated and that have immunity before we can really see these numbers of infections and hospitalizations and deaths come down and stay down. We're plateauing, and that's because people are not getting vaccinated. People are saying it's not my problem, but you're a human being. It is your problem. So we have to, we have to always be careful with our messaging, because it's too easy for people to say, that's not me, not my problem, so yeah, so that's what I would add to the conversation. That is flashback, PTSD, HIV, 1980.
Also, I want to add that oftentimes we find out as healthcare providers, we find ourselves in a position where we are defending the vaccines that actually work that we have, that we never tell the public the full transparent story, which is there's vaccines for COVID that have failed and that has not come out. And that includes Merck Pharmaceuticals vaccine.
Mm-hmm.
It includes another vaccine that they haven't completely failed, but let's just put it like this. They announced that they had a vaccine when Pfizer and Moderna announced their vaccines, which was back in January 2020, right?
Mm-hmm.
Called Novavax, which is a Maryland-based pharmaceutical company. Then Novavax was found that against the South African strain, that their vaccine was under 50% effective. And the government pretty much told them, no, we're not going to prove that. So they said, all right, we're going to go back to the drawing board and make some tweaks to address that specific strain. So it's not anybody who comes up with a vaccine is getting approved and we're just throwing it at people. So it's very important for people to understand that. The other thing that people have to understand, like I saw this post on social media that got under my skin. I decided I was going to stop being busy and answer everybody that posted it. And it said, HIV's been around for how long, but we don't have a vaccine. Cancers have been around for how long, but we don't have a vaccine. The common cold has been around for how long, but we don't have a vaccine, right? And then they said, but we have a COVID vaccine. And now start breaking down for people and saying, listen, there's trials for HIV vaccines that are going on that they're looking at, right? That's for one. Two, there's literally a medication that you can take every day that'll protect you, guarantees you 99.99% chance that you will not get infected with HIV, right? We call it PrEP. That's also how a vaccine works. That same pill, you can also take it if you are exposed to HIV. And if you start taking it right away, we can guarantee that you won't get infected with HIV, right? Then when we move on to the cancers, there's certain vaccines like the HPV vaccine that protects against cervical cancer, right? And this is why we say, don't just give it to little girls, give it to little boys too, right? Because I need these little boys out here being protected in case my daughter grows up and have sex with them, right? That's a vaccine that protects against cancer. There's also other treatments of cancer where you have your surgery for breast cancer, you take a pill once a day for a certain amount of years, and then your breast cancer won't come back. Like you have these type of things that's been developed. And in regards to the common cold, I laugh so hard because the flu vaccine is literally a vaccine for the common cold, right? Like it's literally a vaccine for the 4 most common strains of the common cold every year. So people are just running with foolishness because they're so upset about it. But I do understand that part of it is them being scared, right? And that's also part of people like us not being in the room when they have the conversations. Like the CDC thought that they was going to pose Johnson & Johnson, and people were just going to say, oh, okay, we just won't get Johnson & Johnson, we get the other two. But you know what Black and Latin people go? They do? No, I'm not getting anything. Nothing at all.
Mm.
You told me all three was good, now one has a problem. We're not getting nothing at all, right? Mind you, it was a 1 in a million chance of getting the blood clots from the Johnson & Johnson vaccine. That you have more of a chance of going outside, being struck by lightning twice, and then tripping and falling and dying than you did of getting that, right? And it was just certain ways that they should have handled it that they didn't handle it. But let me stop rumbling.
Thank you for that. You know, I could always count on Dr. Johnson to kind of sort of bring it home with some real layman's term things that really resonate with our students. He's always been good to kind of sort of bring it home on that regard. So thank you for that. And the next question does go to Dr. Johnson and Dr. Maldonado. And you touched on it a bit, but I want you to get a little bit deeper into it. Is why do you think communities of color are reluctant to get vaccinated? Touched on one of those reasons, but you know, I think there's some other things that the group can stand to learn from.
Well, Dr. Johnson had put it in so beautifully when he just spoke a little while ago, but I think it's really fear. They're afraid. If they notice one little thing that one of the vaccine is not working or has been retracted, immediately they will harp on that. Today I had a patient and I said, did you get vaccinated? She says, no, because the vaccine already is causing blood clots. And I tried to explain to her that this was not so. Then she said, well, I don't know what's going into my body. And maybe it's something that the government is trying to control us. And sometimes you try to dispel these myths that they're not true. And that, you know, you have to try to protect yourself and protect your family and protect the community. As much as I tried to educate her about it, she was still very, very fearful about getting the vaccine. And when you throw out one little thing that there's a snap in a vaccine, immediately they will absorb that negativity. Dr. Johnson, you wanted to add something on that?
Yes. And I want, and funny enough, Dr. Maldonado and we was talking about this in a pre-call last week, where people are afraid. And I often tell people, if you come talk to me about the vaccine and you're Black and you tell me you're not afraid, I'm a little worried about you, right? Because if you're Latin and you're not afraid of the vaccine, I'm a little worried about you. There's some things that has happened to Black and Latin people in this community at the hands of healthcare providers, plain and simple. Right? I am not here to ever make you think that these things didn't happen, right? The trials in Puerto Rico, the Tuskegee experiment. What happened to Black moms and still happens to Black moms when they are pregnant. I'm never going to sit up here and defend that as a healthcare worker. I'm gonna let you know that I understand it and I understand your fear. In fact, I also know that it takes several points of engagement to get somebody to become comfortable. I also know the effect that it has being a Black healthcare worker, Dr. Maldonado being a Latin healthcare worker, and us putting the vaccines in people's arms and what it means to them. Like we're running vaccine sites, and when I walked into the vaccine site that we were taking over in East New York, Brooklyn, which is a predominantly Black neighborhood, right? And we walk into this Black church and they see us and they told us we have a sigh of relief because the Black Nursing Association is here. And because y'all are telling us y'all are going to be here throughout. It doesn't matter what the color of the vaccinators are now, because the people running it are Black. And the people we come to when we have a problem are Black and they understand us. And that's a big thing. And that's something that we try to tell people who get grants to run vaccination clinics. You need to employ Black and Latin people in Black and Latin neighborhoods so they feel comfortable, right? I know I have my own personal reasons for having it. I also made sure that I specifically took Johnson & Johnson, and people asked why. And I said, because before Johnson & Johnson even was approved, there was a lot of controversy surrounding them because of the talc and powder, right? And like I tell a lot of my people, there's a conversation we're gonna have about the way we use powder offline that I'm never gonna have in front of white people, right? But I knew that it was controversy surrounding it. And I wanted to be able to tell my people, get any one of the three. I don't care which one you get. And when you say, well, one of them is controversial, I can raise my hand and go, as a Black doctor, I got the most controversial one. And I'm standing here right in front of you. And it helps to make a difference.
Thank you. Thank you for that. And that actually leads into our next question. And this is for all of our panelists. And I'll take the stab at answering that. Why did you get vaccinated? So I think Dr. Johnson answered that question as well. And then I'll share with you all why I did. So when COVID-19 first happened, my son, my wife and I had our first son, and he was about 5 months at that point. My wife did not leave the house at all. I did all of the grocery shopping. Every time we had to go out, I went out. She was so fearful of what would happen with her or our son that she did not leave the house for almost 4 months, did not leave the house. She was working from home as well, so she didn't have to worry about work. I never got tested for COVID-19 because I just did not want to continuously have that thing shoved up my nose. But as soon as the vaccine became available, I made sure I was there and ready to do it because I wanted my son to be able to see his grandparents. So I advocated and stressed to them. And my dad, who does not like any needles at all, any type of medication, said, I got it for my grandson and my granddaughter on the way because I don't want to be the reason why they're not okay. And that was big coming from him. My mom is a nurse, so of course she had to get it. She's a frontline worker. But really stressing that importance of family was the reason why I got it. Family was the reason why I said I had to go get it. That's the reason why I get the flu shot and the Tdap, because never before my son had I gotten Tdap or the flu shot. So that was my reason for getting vaccinated.
So I'll jump in. You know, I have a responsibility. I have a responsibility as a nurse, as a healthcare provider, as someone who has a trusted platform, who has a sphere of influence. And if I'm gonna talk the talk, you gotta walk the walk. So yes, I am fully vaccinated. I went ahead and got Pfizer because at the time that was the one that was available to me. I did fine. So now I can speak with a certain level of credibility when I talk to my family members as well. You know, one of my mother's sister called me one day. She was like, you know, I'm at my doctor's office. They want to give me this Moderna. What do you think? I'm like, you are 74, an ex-cancer survivor. You are at risk. You need to let them give you this vaccine. And she went ahead and did it. The other thing too, and I want to make this point really clear because Dr. Johnson hit it on the head. The fact that the Johnson & Johnson vaccine is temporarily paused the way they did it proves that the system that is put in place actually works. They were watching, and it was out of an abundance of caution that they paused it. They're going to figure out exactly what happened with those very few cases. And then I suspect, if not already so, they're going to reauthorize its use, either with some type of a warning for certain populations, or we don't know exactly what they're going to do. But so many other millions of people were vaccinated already with the Johnson & Johnson vaccine with no side effects. So the system works, people. This was the system working.
Dr. Johnson, they released it. CDC and FDA recommended Johnson & Johnson be restarted with a label saying that.
Thank you. I knew the meeting was happening. Yeah. I knew the meeting was happening, Dr. Johnson. Yeah. I just hadn't seen the report yet. Thank you, sir.
No, I looked it up as we started talking about it. I was like, I've been waiting because I've been telling everybody on Friday you're going to hear that
It was at 6 o'clock. It was literally the same time we started this.
Yeah, I think they mentioned it before that they wanted to actually put the label on warning about the possibility of blood clots, even though it's so low, but you know.
And that's fine.
So Gabriel, Gabriel, do you want to answer the question? Because I know we spoke about it before as well.
Oh, yes. In terms of the vaccine, right?
Yes.
Okay, of course. So the reason I got vaccinated was, well, for two reasons. Well, three actually. One, for my safety, especially nowadays with everything that I've been through, and I know a whole bunch of people have been through. It's best to be safe, especially in these times. Number two, for my family. I help to support my family. Obviously, I love my family and I care for them, so I want to protect them. And number three, kind of as what the doctors were saying, we have a responsibility not only for ourselves, but for everybody else that is in our communities. So I urge you, if you can get vaccinated, please do. Even if you have a little bit of fear, or if you know somebody that has fear, please just try to, inform yourselves. I kind of already know a lot of this stuff beforehand, but it's good to, re-jog it. And whenever I do see somebody that's on the street that has doubts, I try to explain to them. And I say, I know that our communities have had a history with, some bad things that have happened to our communities through, a medical standpoint. But we have to understand that this is out of necessity. This is not something that they're targeting one group. They're giving this to everybody. So it's not to bring down one community, but it's to bring down everybody else. So thank you.
I didn't get to share why I got vaccinated. I mean, and again, for a couple of reasons. One, being an educator, right? So, I have been. I'm sitting here in front of my computer, and this is what I do all day. I sit in front of my computer, and I miss my students. I miss them terribly, and I want to get back to being able to be with them in a classroom, to be able to see their faces when we talk about these difficult topics, to know when, when it's not going well with them and they need a little more of my attention. That was one of the reasons. The other reason is that I am at high risk. I have comorbid conditions. So that was another reason to protect myself. And again, protecting my family. We are all vaccinated. We all got vaccinated on our own, and in the sense that we didn't go together. We accessed it in different ways based on our being part of different different criteria. Myself, as with my connection to NYU, my daughter is an educator, my husband has risk, and my son also has risk, but we all kind of went to different places. So it turned out the adults, or the parents, we got Pfizer, and our kids both got Moderna, and small side effects, but we are doing good. Other family members we tend to be a family that, yes, we'll go for the vaccination. So other family members of mine are vaccinated, but some of them cannot be vaccinated because of age, because of other conditions. So these are individuals that we still have to be careful when we see them. We still have to wear the masks. We still have to, if we're indoors, being really careful. We're going to try and do things outdoors so we can see each other again. Being Latina, I miss being with my people. And I have lots of people. I miss being with all of them. I'm missing the hugs and the kisses, and I'm looking forward to being able to get back to that. So.
Thank you. Do any of our other panelists want to share? If not, I'll jump to our last question before I turn it over to Jada.
I'd like to say I got vaccinated as a responsibility to myself, to my family, but most importantly, I got vaccinated for the mothers and babies that I take care of. When I do a delivery, it's so important that I am safe for them. And as they birth, I want to make sure that they are safe with me. And also for my Latin community, which I love so much, for my Black mothers, which I care deeply about, and for all of us to be safe and protected.
Bernard?
I have the first shot of the Pfizer. I'll take my second shot next week. But I did take the vaccine because I have two little ones taking care. I have to take care of two little ones. I have to work. And living in the Bronx is you share everything with everyone. You take the train, you share with thousands of people. You walk in, you share with thousands of people. I do customer service. I interact with a lot of people. And I have to take care of my family. And I also have to work. What do I have to do to take care of myself And at the end of the day, still go back to my family and be sure that everyone is safe. I don't mind coming to work without a vaccine, but I also have to think about the people at home because they need me, I need them, and I need my job too. And then our work too, people also need me to come to work so they could also have the customer service they deserve. And I don't want to put people at risk because I don't want to take a vaccine where I don't know who I'm going to get the virus from because I interact with a lot of people, from get it out from your apartment, in the elevator, in the train, walking on the sidewalk, coming to work, going everywhere. You interact with people most of the time. And living in the Bronx, you are at high risk, even though you're not sick or you don't have any possible side. Let's say you don't have any life-threatening effect, like heart diseases and stuff like that. You could still get it anywhere. So we being as a family and being in the Bronx, we all have this kind of connection around us there. We are all a family. So no matter what happens, if someone is not taking it, I have to make sure that I take it to protect myself and also to protect other people around me. So it doesn't always have to be about me. I took it because I know I live in the Bronx, and then we are a lot of people here in the Bronx. And if you still want to live in the Bronx, we have to make sure that we protect each other. Yeah.
Thank you all. Thank you all. So the last and final question, and this is again, a question that I will lead to Dr. Fields and Dr. Johnson is, or any one of our panelists, who can get vaccinated? Because we had this conversation in our pre-call, right? And so I wanted us to speak to that. Really, who is eligible to be vaccinated?
So now anybody 16 and over is eligible. But going to Dr. Crespo's point, there are some people who are going to find themselves not able to be vaccinated because of various reasons, health reasons, primarily being one. And there are those who are going to have some religious objection or other, cultural related issues. But that brings us to the point. Most vaccinations are recommended. A lot of people think, oh, isn't certain vaccines mandatory? No, because it's really hard to mandate vaccines because of the exceptions that we always have within our society. But there are jobs and institutions who can require certain vaccines of employees or populations, much like we require of our healthcare students. We require at the university that you have certain immunizations in order to protect you and the patients when you go into your clinical rotations. So that's a difference. And I just wanted to make sure about that language.
Yes, and it's all three vaccines that's authorized for use in America are available for anybody 18 and up. Pfizer is available for anybody 16 and up. They're also currently doing a trial right now for 6 months to 16 years of age. And if that gets approved, then pretty much everybody 6 months and up would be able to be available for Pfizer. Everybody else is 18 and up. And if you have family members outside of America, it is AstraZeneca. AstraZeneca works similar to the way that Johnson & Johnson work in terms that it was made in a similar fashion. But it's 2 doses instead of, it's two injections instead of 1 injection.
So thank you. So
I just wanted to add, there's a new update in New York City. Anyone 16 and over can go to a walk-up location and get vaccinated. So I put in the chat the one that is on.nyc.gov/walkupvax. You can have your list of locations throughout the city. Anyone 16 and over, and of course, if they're 16, it's going to be the Pfizer one. And as we discussed in our meeting before, Lehman is on that list. Lehman College is on that list. So that is a new development as of today. Outside of New York City, The walk-ups are only available if you are 60 and over. But New York City, 16.
Thank you.
Sweet 16 gifts.
Sweet 16. So if you all pay attention to our chat, we've been putting a lot of information there. So there are several sites. There's the NYC Vax Finder site. So that's for New York City vaccination sites. There's a link there to the SOMO site. There's a link there to the New York State site. There's a link there to the walk-up site, a link and an attachment with resources from Dr. Fields, his presentation, and a number that one can call to set up an appointment for a vaccination site. And just recently, my sister-in-law, who works with public safety at Columbia High School, just shared with me that on Monday from 3:30 p.m. to 6:30 p.m., no appointment needed. You can walk up and get vaccinated at Columbia High School in the Bronx, which is 925 Astor Avenue. So there's options out there for folks who are interested in getting vaccinated. And I'm going to see if I could download her flyer that she sent me and put that into the chat as well, so you all can have it. I want to conclude this section and then turn it over to Jada by saying, who can also get vaccinated is anyone. You do not have to be a US citizen. You do not have to have health insurance. I want to make that clear, because particularly for our communities of color that find themselves in predicaments where they say, well, I don't have insurance, I'm not a citizen. Can I get vaccinated? Yes, you can get vaccinated. So I'll turn it over to Jada Quinlan now, who is our student government president here at Lehman College, to take us into some of the question and answer piece from questions that we've comprised from our SGA students and our SLA students, which is our Student Legislative Assembly. So Jada.
Thank you. I honestly appreciated everybody's responses, and I'm excited to hear your responses to these more specified questions. So the first question is, would you recommend pregnant students to take the vaccine? This question can go to anybody, by the way.
So I'll take it because I was just having this conversation with a friend last weekend. And the honest answer is that it comes down to your comfort level because of this, right? Well, actually I have to, Pfizer is currently doing a study on pregnant moms, right? So prior to that study, there was no defined study for pregnant women. What there was anecdotal studies, meaning women who were pregnant had just decided to go ahead and get the vaccine because they trusted that it was going to be safe. And those women that had just went out and got the vaccine, they were okay, right? Baby also came out okay. However, officially, that study is being done. It is a much smaller study compared to the vaccine trials that was done for all of these vaccines. So it really comes down to your comfort level.
I have to add that I agree with Dr. Johnson totally. Pregnant women can get vaccinated. It's a live vaccine. In addition to that, it also depends on their comfort level. So yes, I agree with Dr. Johnson. Studies are still being conducted, but it is totally safe if they feel that they want to get vaccinated.
I will also add, because I spoke to Dr. Johnson as well, because my wife is currently pregnant and she did get the Pfizer vaccine. And I didn't want to share that yet until after your question, Jada, because I didn't want them to answer it prematurely because I knew you were going to ask that question. And to that point, it was a personal choice. But what kind of sort of pushed us over the edge is that her brother recently passed away from COVID. So it became the reality within the family, because my wife is also in law enforcement and she had all thoughts of getting vaccinated before we found out that we were pregnant. And she said, okay, now let me kind of see what happens. Some of the issues is that pregnant women are considered from a research standpoint a protected class, right? So it's oftentimes that when we have protected subjects within a research context, it's difficult to have large sample sizes of these protected classes. So that was one of the reasons why the sample sizes were so small or far and few between. But what did it for us is that I did see an article. It was a small sample size of 131 pregnant women, and they did a research study indicating the side effects for them and their children or the fetuses at the time. And it was really statistically significant that there was no difference between mothers who received the vaccination and mothers who did not receive the vaccination. Other than the reality of it is that the reason why we're getting vaccinated, and I think President Lemons said this as well, don't run from a mouse to be eaten by a bear. The reality and what brought it home was the passing of my wife's brother is that death is a possibility. So if she passes away, depending on how far along she is with the pregnancy, so too does the fetus. And then that was the really scary part about it.
Thank you. Thank you, guys. Not to put you on the spot, Dr. Wright, but I like that she said we are pregnant. Okay, so the next question, if nobody else wanted to answer that question, the next question is, what are the elements found in the COVID-19 vaccine, and what are the differentiations between the Moderna and the Pfizer vaccine? I saw in the presentation that the Moderna and the Pfizer are both mRNA, if I'm not mistaken, that type. So what does that type mean specifically when it comes to the elements?
It deals with the technology or the science behind how it was developed. And like I said, the Johnson & Johnson, the adenovirus, they use what is called a vector, sort of a delivery system that gets the vaccine into your system, as opposed to the mRNA, which is messenger RNA that actually has a different mechanism of attaching to the cell and through protein synthesis of creating an immune response. So that's about as layman terms as I want to get, because I don't want to give you a long soliloquy in vaccinology, but it's just a different scientific route.
Let me give it a try.
Go ahead.
Thank you. Thank you, Dr. Field.
So with the mRNA, it's actually that genetic material, and it is prepared in such a way that when it's injected into your body, it can tell the body to produce what looks like, is not really, but what looks like the exterior part of the virus. And then that will get the immune system to make the antibodies. The vector has the same material, but it's literally, think of it as like going for the walk versus taking the cab, right? Or the Uber, or whatever it is you're going to take. So the vector is the Uber that's going to deliver it. And the
That's
mRNA.
Johnson & Johnson? Sorry to stop you. That's Johnson &
Yes,
Johnson,
the vector vaccines is Johnson & Johnson and the AstraZeneca. But in the same way, delivering that, that material, which then triggers the immune system to respond. In the mRNA, and this is a huge concern for a lot of people, because they think that, oh, I'm injecting this genetic material, now my genes are going to be changed, and that's going to cause all these problems, particularly for, it's an issue for women who are pregnant, that thought. But actually it's almost like, so like if you think of those spy movies, right, where you get the message and it says, this message will self-destruct in, okay, the same thing. So after it does its job, the body says, all right, get out of here, we don't need you anymore, and the body removes it, so that genetic material does not stay there anymore. So I hope that helped.
That did. Thank you.
It helped me. I thought that was really good.
Thank you. Okay, the last two questions are, I would say personally, are the hottest questions. And the first one is, and I think Dr. Johnson spoke about it a little bit, but this question asks, now that the vaccine is open to everyone, do you believe that the mask policy would be removed from the social distance policies over time?
So and
Dr. Phil shaking his head.
Yeah, of course, this is a best guess scenario, right? Because we're not using exact science here. My best guess would be that it's going to end up being removed, especially for people who are vaccinated, because the government, like right now, there's a mass mandate that people cannot be sued over COVID, right? Like people in businesses, the healthcare system, you just can't. One of the fears is that when you remove this mass mandate, if somebody gets COVID and becomes hospitalized, if somebody gets COVID and die, people are going to get sued. So I think what might end up happening is that they're going to move towards, we're removing the mask mandates, we're removing the social distancing for everybody that's vaccinated, right? And then it's going to be, once we also remove it, you may not be able to sue if you actually contract COVID if you did not get the vaccine. And
Makes sense.
especially in the fall, because a lot of schools are pushing to go back in the fall semester, right? Just because a lot of schools have been sued over certain fees that they have charged students, right? The enrollment has dropped. So with this push, one of my fears is that they're going to say, well, everybody had a chance to get vaccinated for 4 months before school started. If you didn't get vaccinated, you just didn't want to get vaccinated. And then they're going to tell everybody, come back to these crowded spaces. And the people who's going to be at the most risk of catching COVID and dying is going to be our people.
Yeah. And you also have to remember, there are certain states and other places that have already removed their mask mandates. You know, some of them are, most of them are in our southern United States. They're those red states that, you know, voted a certain way. And there's certain states that I'm not going to personally, but it's already happening, Jada. It really is.
Okay, thank you.
It's just a matter of, it's just really a matter of
we
when.
need to have that herd immunity for protection. I mean, even though, you know, like, you know, I'm fully vaccinated. It's been past the 2 weeks. But I still wear a mask when I go out because there's still, those variants are out there and I still need to protect myself. The vaccine will help me if I get exposed. My mask helps me, my social distancing helps me from getting exposed. Yeah. So that way, you know, I see my vaccine as my backup, you know, and that it's that mask and that social distancing that's protecting me from the exposure. So I think we still need to be careful, even if we've been vaccinated, because there's so many people who can't get vaccinated or who won't get vaccinated. Whatever that reason is, we need to continue to protect each other.
And to add on to what Dr. Crespo-Fierro is talking about, most likely they're not going to, at least nationwide, not remove the mask mandate and the social distance mandate until there is herd immunity. Just for the protection of the nation as a whole, they want to have kind of like a base. And obviously, you're going to have blue states, red states that, based on state laws, they're going to do it at certain rates. So we already starting to see red states are doing it more quickly. The bluer states are kind of going to be falling behind a little bit because, you know, we want to be, you know, more safe. But yeah, it'll eventually happen, possibly within the next year. But there's definitely a safety that we want to maintain, at least here in New York, until we're able to, you know, first have herd immunity, vaccinations, you know, far wide, I guess you could say. And then, you know, after that, they'll probably start loosening some of the protections that they have.
Thank you, guys. I honestly agree. I believe the vaccine is to protect you and the mask is still protecting you, but more so to protect everyone else around you. So my last question is that a lot of our STEM students at Lehman, especially in our nursing department, they want to get engaged in the relief of the pandemic. So where could students, if possible, volunteer for on-site vaccination?
I think that's a Dr. Maldonado question.
Well,
Yeah, I was going to say, that's up to you, doctor.
We're actually vaccinated in Lehman College. That you can come in and get vaccinated. So that's one of the ideal spots to go. Why not go where I'm going to school and get vaccinated and also get the proof of that so that I can attend school in September or when CUNY decides to open up its doors. And there's multiple sites in the Bronx now. So you know, Jada, there isn't an excuse. It's
Sure.
a personal choice to protect yourself and to protect others. So we welcome everybody at Lehman College. If they want to get vaccinated, they can, absolutely can.
Thank you. Do you also think it's possible for them to volunteer at the same site, at the Lehman site?
Again, it depends where that nursing student is. Do they know how to give an injection? Will there be someone there, such as faculty, to monitor them that they're getting the injection appropriately? That's something that we would have to bring it up to our wonderful chair, Dr. Georges, if she can, you know, should be able to volunteer if they have the knowledge and there's someone supervising them.
They can also volunteer with registering the people that come to get vaccinated. They can volunteer with scheduling second dose, because I'm assuming y'all are giving Pfizer and Moderna, right? Most New York City vac sites are giving Pfizer and Moderna. So you can volunteer with the scheduling afterwards. You know, all of that helps.
Now, are they doing them at LIU in Brooklyn?
No, listen, don't get me started. We at the so the Greater New York City Black Nursing Association is in a partnership with Community Health Nursing, Fairly Qualified Health Center. So they have
NYU.
Yes,
And NYU.
I'm sorry,
Okay.
you are absolutely right. And NYU and LIU. We are in a partnership with helping them run their sites. They have 4 sites: Washington Heights, Harlem, East New York, Brooklyn, and Jamaica, Queens. In addition to that, they also have pop-up sites that they do. So if some of you have a neighborhood where y'all can guarantee you can get like 100 to 200 people that want the vaccine, you can let me know. We will arrange to do a pop-up site in your neighborhood to get those people vaccinated. I'm all for bringing it to the neighborhoods where our people are and having our people vaccinate our people so they understand that it's safe.
It's amazing.
Yeah, and the National Association of Hispanic Nurses, our chapters, is collaborating with Arch Care, which is through, and again, trying to build up trust. A lot of Latinos will be trustful of services that come through the church. So we're also coordinating with them, and we'll be doing that New York City and also getting into Westchester and Hudson Valley. So that's something that we're currently working on.
So we have hit, we're about 4 minutes shy of our end time. And I do want to thank our panelists, thank Jada, thank the Student Government Association, thank the Office of Campus Life, thank the Urban Male Leadership Program for putting this together. And again, just thank our panelists, because I think you all did a wonderful job of really demystifying, breaking down, and educating our students, the Lehman community, and I'm very grateful to you all for spending this Friday evening with us. You could have been anywhere else, but you decided to be here with us on a Friday evening to really talk to the heart of a matter that is germane to our communities of color, and really how do we begin to have the dialogue and conversations and walk that walk, as some of our panelists said, by getting vaccinated and being that example for our communities, our students, our family members as well. So thank you all. And I did see a hand raised. Somebody wanted to say something, but I want to give our panelists a round of applause. And then there were 2 hands. We have John, and then I will get to Professor Dees, and then we will close out.
Yeah, thank you very much. This Reverend John Odokon from Word of Life International. I'm requesting Dr. Johnson to give us his contact information so that we can invite him to our vaccine projects.
Okay.
All right. So I'm going to put it in the chat, but also, so for those of you who don't know, Dr. Jermaine Wright and I have been like this since 2001, right? So he has all of my information. We went to college together. We was finishing up our doctorates around the same time. Like we're as thick as thieves. So he has my information. I'm also going to put it in the chat for everyone to see as well.
Michael Dees.
Yes, I just want to say to Dr. Jermaine Wright, to the panel, to our dynamic student government students, and just such a dynamic, informative panel. I too, I've taken the Moderna, and my wife, she's taken Pfizer, and this is something that need to really be widely, not just at Lehman, but just across, definitely to our minorities. So God bless each one and every one of y'all. It was such an informative event. Thank you all.
So we shared at the beginning that we were recording it and with the purposes of sharing it with our student population widely. So I do think our tech person, Gio, will ensure that it's on Facebook Live and it will go on in order to share this information, this critical information across not only Lehman, but across the ethers around thinking about how do we as communities of color have this meaningful conversation. And I do want to say that, you know, this was this spark was given to me by Dr. Johnson and Dr. Fields, who had a similar community conversation with Divine Line organizations and Johnson & Johnson, not to prefer one vaccination over the other, but allow Johnson & Johnson to speak to communities of color directly. So it was from that conversation that I said we need to do this for our students at Lehman as well. So thank you all for inviting me to participate in that conversation as well. So I will let everyone enjoy the rest of their Friday evening. My little one is calling. He wants me to go and be with him now, but thank you all. This has been really informative, and I'm thankful for you all and the work that you continue to do. Have a wonderful evening. Thank you, everyone. Hi, El Gloria, our Dean Harrison, the Dean.
Hi, everybody. Have a good weekend.
All right, have a good weekend.
Bye-bye.